Assalamu alaikum. My name is Fiza. I am from BS Mathematics department. Today the topic of my presentation is Epstein-Barr virus. First of all, I will explain the introduction of EBV, history, epidemiology, transmission, clinical manifestation, complication, and diagnosis and treatment or prevention of EBV. Introduction of Epstein-Barr virus. EBV is a very common and highly contagious infection. Contagious means spread from one to another, able to be passed from one person to another by touching. EBV, also known as human herpes virus 4, is a member of herpes family. Virus family, it is one of the most common human virus. Herpes virus that causes skin infection and is categorized into two types, type 1 and type 2. Type 1 transmitted oral to oral, symptoms known as cold sores. Type 2 sexually transmitted infection that causes genital herpes. It is one of the common human viruses. EBV spread mostly commonly through the body fluid, primarily saliva. EBV can cause infectious mononucleosis called mono and other illness, and rare cases led to cancer. Mononucleosis means it is a viral infection that causes a sore throat and fever. Causes often happen in teen and young adults, and rare cases lead to cancer. Next, the history of EBV. EBV, the first isolated human tumor virus, was identified in 1964 by Epstein's group in a cell lines derived from Burkitt lymphoma. EBV is a human herpes virus classified with the gamma herpes virus subfamily and is prototype from of the cryptovirus genus. History. EBV, the first human tumor virus, was discovered in 1964 in cell lines from African Burkitt lymphoma tissues. Burkitt lymphoma basically is a form of non-Hodgkin lymphoma in which cancer starts in immune cells form called B cells. Next, epidemiology of EBV. EBV is estimated to be positive in more than 90% of the world's population. In developed countries, two peaks of infection are seen. Preschool children age 1 to 6 and the second adolescent and young adult age 14 to 15. 80 to 90% adults are infected. In developing country, infection occur at a much earlier age, so that by the age of 2, 90% of children are seropositive. The primary infection is asymptomatic and occur during childhood. Next, the virus has been linked to a wide range of malignancies such as post transplant lymph proliferative disease, non pharyngeal carcinoma, Hodgkin lymphoma, and gastric carcinoma. Next, structure of EBV. EBV consists of double-stranded DNA surrounded by an isosahedral protein capsid containing 162 capsomeres. Means, like other viruses, EBV is a DNA virus with a triode shape protein core that is wrapped with the DNA nucleocapsid with 162 162 capsomeres, a protein tegment between the nucleocapsid and the envelope. The mature version approximately 120 to 180 millimeter in diameter. Diameter of 120 to 180 millimeter. This is a structure of Epstein-Barr virus. Next, transmission. Infection mechanism. Infection with EBV occur by the oral transfer of saliva and genital secretion. The host cell of EBV are mainly lymphocyte. Lymphocyte are type of white blood cells. They help your body immune system fight cancer and pathogen viruses and bacteria. And epithelial cells. Epithelial cells that occurs the inside and outside of the surface of your body. Mechanism for entering these two cells are different. To enter epithelial cells, viral protein BMRF2 interact with intracellular beta 1 integrin endocytosis of the virus into the vesicle and fusion of the virus with vesicle membrane release the nucleocapsid into the cytoplasm. Once the viral nucleocapsid is dissolved, EBV interact oral epithelial cell with viral replication, cell lysis, and release of variants that separate to the contagious structure include the salivary glands. Local replication in oral epithelial and lymphoid cells may be basis of the symptoms of pharyngitis. Is the inflammation of pharynx. Next, to enter B cells, viral glycoprotein GP350 bind to the cellular receptor CD21, also called CR2. Viremia in sources with infection of the primary cellular target of the EBV, the B lymphocyte into the peripheral blood and the entire lymphoreticular system, including the liver and spleen. In B cell, lytic replication normally only take place after reactivation from latency and some latently infected B lymphocyte enter the viral replication or lytic cycle that began with EBV. Early antigens production proceed to the viral DNA replication followed by the structured glycoprotein production including manufacture of viral capsid antigen C, that is CVCAS, and culminates in that cell death with release of mature variants that are shed through secretion and symmetrically infect other B lymphocyte. Reactivation apparently is asymptomatic. This is a mechanism of EBV, primary infection and persistent infection. Virus enter into the B cells and further blasting of B cell, primary invasive T cells, and intensive stage and reactivation and again lysis. Basically, the reactivation means the exact cause for the viral reactivation is not yet clear. However, chronic psychological stresses and the weakened immune system of the host has been observed to induce the reactivation. And latency, infected cell further infect new B cell and epithelial cell that aid in the viral shedding and transmission. And lysis is the breakdown of cell or membrane. Lytic form of EBV infection is required for the production of progenitor virus and is thus essential for cell to cell separate of the virus. And transmission from host to host. Next is transmission of EBV. The oral route is the primary route of transmission for the EBV virus to the saliva containing the infected cells. Transmission means spread mostly through the body fluid, especially saliva, through blood transfusion, organ transplant, or spread by using objects such as toothbrush or drink glasses that are infected persons. The presence of infected cell in the uterine cervix and semen is also suggestive of transmission through sexual route. Next, clinical manifestation of EBV. Many people get infected with EBV during the early childhood. They may be asymptomatic or generalized symptomatic similar to other childhood diseases. Symptoms of EBV include fever, fatigue, inflammation of throat, swollen lymph node in the neck, enlarged spleen, swollen liver, or rash. Problem in central may include fever, loss of appetite, meals, headache, tonsils mean reddening, swelling, white patches, spleen enlargement, abdominal pain, nausea, vomiting, lymph node, throat soreness, and reddening. Next is the complication of EBV. Complication of EBV include cervical lymphadenopathy. Cervical lymphadenopathy is abnormal enlargement of cervical lymph node present in the neck region. And the next is hepatitis. Hepatitis inflammatory condition of liver. And then next is splenic rupture, medical emergency that cause life-threatening internal bleeding. Next is thrombocytopenia. Platelets count in blood is too low. Next are neurological disorder, meningoencephalitis, Guillain-Barré syndrome, GB syndrome, or Bell's palsy. Bell's palsy is sudden weakness in the muscle on the face side of the face. Late complications include lymph proliferated cancer. Multiple sclerosis is a disease of central nervous system, rheumatoid arthritis, autoimmune or inflammatory disease, which means that your immune system attack healthy cell in your body, causing painful swelling. Usually occur in small joint of the body like hand, feet. Next, chronic active Epstein Barr virus infection. Next, diagnosis of EBV. There are two methods for the diagnosis of EBV. First one is non-specific and the second one is specific test. Non-specific tests include peripheral blood smear, heterophile antibody test, liver function test. And the second is specific test, EBV specific antibody test, viral detection and qualification. Peripheral blood smear, presence of atypical lymphocyte is seen in the peripheral blood of patient with infection mononucleosis. These cells, also known as Dowry cells, are activated. CD8 T cells. Next is the heterophile antibody test. Consider the best initial diagnosis test for EBV. Related IM, liver function test. Patient with infectious mononucleosis with show abnormal liver function test during the early stage of infection with increased level of enzyme, especially alanine aminotransferase. And the next tests are EBV specific antibody test, EBV viral capsid antigen IG and IgM antibody tests are used in the diagnosis during the acute phase of disease. Next, viral detection quantification. EBV encoded RNA transcript is considered the gold standard for detecting EBV in tissue. That the virus can also be detected and quantified through molecular method like PCR. Next, treatment of EBV. There is no specific treatment for the EBV virus infection. However, symptomatic management of infectious mononucleosis can be done by using the antipyretic and analgesic to reduce fever and pain during acute stage. Another treatment, oral rehydration and the nutritional diet can be especially important for febrile patients. Next, proper bed rest, use corticosteroid antiviral drugs like acyclovir and valacyclovir can be used in the treatment of infection. These are the treatment of Epstein Barr virus. Next is the prevention and control of Epstein Barr virus. Vaccination. Prevention. It is rather difficult to prevent the infection of EBV. Vaccination, EBV is the primary cause infectious mononucleosis and associated with several malignancies, including nasopharyngeal carcinoma, gastric carcinomas, Hodgkin lymphoma, Burkitt lymphoma, lymphomas in immunocompromised person, as well as multiple sclerosis. Prophylactic Epstein Barr virus vaccine has the potential to significantly reduce the incidence or the severity of all these diseases. Some preventive measurement of EBV. Preventive measures that can be adopted include avoid activity like sharing, kissing, drink, personal belonging, toothbrush, eating utensils, etc. Avoiding shaking of toys that may contain drool and saliva of infants. Washing hands and maintenance of proper personal hygiene helps mitigate the transmission of virus. Proper screening and testing of blood in the blood bank for the virus can also reduce the risk of the transmission of virus. That's all. Thank you.